I want to first point out there's been a lot of talk about this independent, nonpartisan study that associates some pretty high prices with doing what most Americans believe we need to do, and that's reform health care. And I think it's important to note for the record that this HSI network that's supposed to be nonpartisan and independent is actually a group that is that one of the participants is the modeler for Senator McCain's health care and his work. And it's been pointed out in the press that some of what they say hadn't always been based in fact. And there was one quote that I found interesting that every candidate should say that these numbers were produced by my experts. They're my best estimates, but they're not exact. And if you look at what this same group, this HSI, did in regard to modeling the health bill over in the Senate, they were 4 times higher than what the CBO came in with. So I think we need to know where these numbers are coming from. And as they relate to our tri-committee effort, I think it's important also to note that they said that the analysis has no offsets. Their analysis, there are no offsets in this discussion draft, and that's just patently false. And we know that to be the case. And so if they miss that, hard telling what else they missed.
Would the gentleman yield for just a moment?
On a positive note,
would the gentleman yield for just 30 seconds?
I want to finish my thought here, then I'll get back to my other issues there. On a positive note, they did say one thing that was interesting, and I'll quote, said, in contrast to the Senate version of this bill, the House version is more fiscally prudent and effective. Yeah, for 15 seconds.
Just to say that CBO did not score the full Kennedy bill, so the $1 trillion is really not the final number. I just wanted to clarify the record on that.
And
so we're not comparing apples and apples.
And the numbers,
here.
reclaiming my time, and the numbers that we're being told are nonpartisan and independent aren't real numbers at all. So it's a very, very biased study. I want to get to some policy changes that I believe will lead us to better health care and at the same time drive down prices. And I'd like to get the experts' opinion on this. I'm one who believes that an expansion of technology can really be beneficial in all this, and think that there's a lot more in the area of telehealth that we could be doing that would provide better outcomes and drive down the cost. And there's a couple of examples that I've seen in my district alone. The UC Davis does a virtual tumor board, and they have just example after example of cases where they've helped people and driven down the cost. They talk about one where they were able to confer with a local team and diagnose a patient and a treatment plan for a patient who was in an underserved area, doing this through telemedicine. And they were able to treat it in an uninvasive way at a much lower cost. And ironically, that work is not reimbursable under the Medicare provisions that we have now. I have another case. I just go on and on and on with examples of this, but I think it's an area where we can really pick up some cost and do better health care. And I'd like to hear your impression of that, and if you think that we should really expand the provisions for telehealth in this bill. And we can start with Ms. Pulitz.
I'm not an expert on this area, but I don't believe a lot of private health insurance would pay for that either. And this kind of consulting between physicians, whether it's face-to-face or on the phone or telehealth, I think is very important in patient coordination of care, and that we do need to find ways to support that and reimburse it.
Anyone else care to?
It seems to me that it's a very good idea, but you need payment reforms that bundle payments, that it can include that kind of contact.
These aren't even included in many, many cases. And underserved areas, there's some expansion in rural areas, but urban underserved areas don't get the attention. And underserved is underserved. It doesn't matter where they are. And these are people who are going without health care or were provided at a much higher price.
I agree with you. Look, there's a role for other things as well. I mean, I don't think necessarily everyone needs to see a doctor. There's a greater role for nurses and nurse practitioners. And I really think in the United States we've done ourselves an enormous disservice by not tapping more in terms of information technology. You know, in Denmark, everyone's health record who wants it is put online. You can look up your own cholesterol and track it over time. I think if that's good enough for the Danes, it ought to be good enough for the Americans. I think it also would address, to a small extent, Mr. Becerra's comment about the high level of medical errors we have in the United States. So much technology, if you go to Walmart and you buy your kid a plastic lawnmower, but so little technology in terms of your health records. You can see your doctor right across the street from a hospital, then go to the hospital because you're feeling worse, to the ER, and no one would know any blood test that had been done. It's just absurd. So I agree with your point.